Welcome back, everybody. On occasion, you'll hear of how your state in which you live ranks overall as far as our health is concerned. Well, that's what we're going to be talking about in this segment right now. I want to welcome to the program Dr. Cassidy. She's the medical director with UnitedHealthcare Tennessee. So nice to have you on the program.
It's good to be here.
Great to meet you. We were talking a little bit beforehand, but just so that you all know, here as of late, Tennessee was noted as ranking 43rd for overall health, and this is by the America's Health Rankings annual report. So we're hoping that you might be able to enlighten us all on exactly what that means and how Tennessee is doing, and just kind of where we stand. But first, if you can kind of tell us about the report itself.
Sure. So this is actually the 26th year of the American Health Rankings, and it's a report that's put out by the United Health group, and it is a state-by-state ranking on many health measures to really help give actionable data to states so they can look at places that they need to improve.
Okay, and the last one that we're talking about actually was just released in December.
Correct, in
2015.
December. So this is the 2015 ranking, and Tennessee was 43rd, which, you know, we're in the bottom third, not where we want to be. There's work to do, but we had improvement. So we were 45 in 2014. So we have steadily improved, and even though there's work to do, I think we need to feel good about moving up the ranks this year.
You know, as I was saying, some people hear of this kind of thing, you know, or maybe you might hear about it in the news, read it on an article online, or even in the paper. Should we be putting a lot of stock in these numbers? I mean, should it open our eyes and just say, what can I do as a resident of the state to be able to improve our overall records?
Right. So, I mean, I think hopefully this gives us goals or points to directions on things that we can work on. So for instance, for Tennessee, things that we really struggle with, inactivity has been a big issue for Tennesseans, obesity has been a big issue for Tennesseans, and I think, you know, the story of Tennessee is improvement, but need to continue to improve, and that's what we see in both those areas. So where we used to have 37% of Tennesseans saying they were inactive, we've gotten down to 20, it's actually almost 27, so I'll call it 27%. You know, great, significant improvement, but still 1 in 4 Tennesseans that aren't listing themselves as being active. So need for improvement. Obesity, similar, where we see improvement, we still have a third of adult Tennesseans who are obese or overweight. So, you know, a need to move those numbers and continue to make improvement. And then I do pediatrics also, so I think important not to forget the kids. And, you know, infant mortality was one of those issues that we really, in the state of Tennessee, need to continue to work on. We did see improvement. It used to be 7.3 infants in 1,000 would die before their first birthday in the state of Tennessee. That's down to 7 in 1,000. So small improvements, something we continue to need to work on, though.
Yeah. So, I mean, Tennessee is faced with the challenge of being closer in the South where we like our good food and all that type of thing. But as far as being inactive, we don't want to go in the wrong direction.
Right.
Can you kind of give, and this is, you know, different from the information we'll continue to discuss, but Dr. Cassidy, can you tell folks maybe just a way to improve their health with activity in general? I mean, what's some things simple things that people can keep in mind?
Yeah, I mean, even just getting out and walking, you know, you don't have to run a marathon, right?
Sure.
So small changes over time can make a big difference. And with the weight loss piece, you know, if you're walking more, if you're trying to eat more fruits and vegetables, even losing just 10% of your body weight makes a huge difference in your health status.
Sure.
So really just small changes over time really add up. And I think if we all can just make that start, and right, January is the time we all do that, right? I think that would be great.
Talking back about the report again, how do people in the medical profession use the numbers? When they see Tennessee rankings, what do they, you know, how do they distribute that information, or what do they do with it for the next year? Yeah,
so in Tennessee, I think the governor has really done a good job of looking at these numbers and working through this, and has the Healthy Tennessee program where they're really trying to help Tennesseans work on healthier diet, getting more active, and smoking cessation and tobacco abuse is one of the really big issues in Tennessee that we really need to address and work on. And then United, as a carrier, we're really trying to do our part. So we talked about the pediatric issues, the Baby Step Baby Blocks program. it connects women who are pregnant in that time during their pregnancy, but also the 15 months after their baby's born, for that really critical period of their young infant's life. Really encourages them to make sure they're getting all the screenings and follow-ups that they need to be getting medically for both mom and baby.
So there's a trickle-down, obviously effect when you're talking about statistics like this, because that's where government steps in. Both you said state and even city, I guess, governments probably can hold more walks or lend themselves to providing more information for new moms or people who are wanting to get pregnant, depending on what the stats are.
Right. And we hope that across the country, states are really looking at this as actionable data that they can put programs in place to help improve the health of their citizens.
Any other goals that you would say, from your advantage point, when you go over these kind of reports, are for the following year, besides obviously getting Tennessee to rank 42, 41, 40. I mean, we want to
get out of the 40s, right?
That's right.
I think looking ahead, the obesity, the diet issues, and the smoking cessation issues, I would say, are the #1 things that we need to work on. There are other, and we've kind of touched on those, but I think there are other pieces here that we need to be thinking about. So HPV vaccination was a place where Tennessee was 50th. So we got a lot of room for improvement on that one. And then poor mental health days was another one that came up as something. So, how many days are you stressed or not having a good mental health day? So those types of things I think are really important too, that we be aware of and look at how we can impact those.
And that's something else we probably should have said, now we'll do that now, but we're 43rd overall, but there are specific components to health that maybe we may not even measure at 43%.
Right, absolutely. And then there's some that we're actually better, right? So we actually are 2nd in the country when we look at excess use of alcohol. We have a very low rate of excessive alcohol use. So it's a place where Tennessee is leading. So that's great news.
That is great news.
And then also we have a good graduation rate, high school graduation rate, and a low healthcare disparity between people at different socioeconomic levels. So I think those are positives for the state of Tennessee to be proud of.
Sure. And I was reading just under the America's Health Rankings report some things that people might not consider when it comes to when you're thinking of your overall health, which is violent crime rate and public health funding. Explain a little bit about that too and how important those are.
Yeah, I think we all really now realize there's behavioral things like smoking or exercise that impact our health, but boy, environmental things really have an impact too. So for example, if you live in a neighborhood with a high rate of violence, you're probably not going out and walking or doing those other things or having that sense of community.
Sure.
And we do know that people who are exposed to violence in their youth have a higher rate of chronic illnesses like diabetes and heart disease. So very important, those environmental factors as well.
Since you're exposed to all the details in the report, Dr. Cassidy, are you overall encouraged where Tennessee is at this time and this year, and do you feel as though we'll only progress?
I think we have a positive trend, and I am encouraged by that. I think there clearly are places we need to continue to work hard, but that positive trend, if we can keep, and we're moving the needle on our hardest issues. So if we can continue to do that, yeah, I am encouraged by our numbers.
Very good. Dr. Karen Cassidy, Medical Director again from UnitedHealthcare Tennessee. We so appreciate your time.
Thanks for
having me. Thank you for being
me.
on the program and sharing all this great information with us.
You're welcome.